Good morning again, and welcome to our annual luncheon. Join the movement, get involved today. That's the American Public Health Association's challenge to make ours the healthiest nation a reality by 2030. Our community is challenged to do the same, to join the movement, to get involved right now in Lincoln and Lancaster County. My name is Judy Halstead, and I have the pleasure of serving as the Health Director for the Lincoln and Lancaster County Health Department. I want to thank each of you for being here today and for your involvement in helping us with the public health movement. Unfortunately, on a sad note, our keynote speaker, Dr. Ali Khan, is unable to be with us today as his brother passed away. So we are sending, obviously, our condolences to Dr. Khan and to his family, and we hope to have Dr. Khan come to Lincoln and actually do his presentation on new and emerging issues in public health, but to do that as a separate event for us. So please share your condolences as well for Dr. Khan and his family. But today is a celebration of public health. We're highlighting people and programs in our community that are committed to improving the health of others, and our department is an important part of the public health system, but so are all of you. All of you play the same vital role in partnering with us and each other to protect and promote the public's health. Before I say more about our program today, I'd like to make a few introductions. I know some of these folks have arrived and some of them are still coming, so I'd like to start with Molly Burton, who is the aide to Mayor Beitler. Molly, would you please stand? Molly is our liaison to the mayor's office. She also serves in an ad hoc role in our Board of Health, and she's representing Mayor Beitler today. I know Marie Woodhead is coming. I have not seen Marie arrive yet. She is representing Congressman Fortenberry's office. Senator Ken Haar will be joining us. County Commissioner Roma Amundsen I did see come in. Roma, do you want to stand up and wave so they know where you are? Thank you. Former Mayor Colleen Sang. Colleen, I know that you just, I promised you I would call on you as soon as you had your mouth full, but we really appreciate Mayor Sang having a strong commitment to the health department. She has been at every one of our annual meetings, and she just told me that she comes to every one of these meetings and every one of the chaplaincy meetings, and has been since before she was mayor. So we continue to appreciate her support of the health department. We have additional Board of Health members today. President Heidi Stark will be joining me shortly. Heidi, do you want to wave? Our Vice President Jackie Miller is not here yet, but she will be joining us. Our City Council Representative Jane Raybold. Our Lancaster County Board of Commissioners Representative Bill Avery. Tom Randa. And Lieutenant Colonel Craig Strong. And Craig is our president-elect. He will be taking over as president of the board in May. Now I'd like to invite our Board of Health President, Dr. Heidi Stark, to say a few words. And as Dr. Stark is coming to the podium, I want to take this opportunity to publicly thank Heidi. Heidi's been on our Board of Health for 8 years. In addition, she has been our board president for the last 3 years. She has been very committed to our department and helping us achieve our goals and to be able to make sure that we're towing the line. She's been a great president for us. And if you could please join me in appreciating Heidi for her service. We have a small token of appreciation for her.
Good morning. Actually, good afternoon. No, it's still morning. Good morning. It is my pleasure to be here representing our Lincoln-Lancaster County Board of Health at our annual awards presentation and luncheon. I am honored to help recognize people and programs that have done so much to improve the health of our public. Many of you know that my connection to the health department goes back to my dental student days at the UNMC College of Dentistry. I did a rotation in 1998 at the health department division that put me on the mobile dental health clinic, doing oral health screenings of children in the most impoverished areas of Lincoln. I certainly did not expect to see the same sad cases of dental decay, infected mouths, and children in pain that I had seen on mission trips to Honduras. But there they were, right here in Lincoln, Nebraska. Certainly, those experiences have contributed to my resolve to become a pediatric dentist, open a practice, and serve underprivileged children in Lincoln. I say this to emphasize that joining the movement and getting involved in protecting our public's health is definitely a team effort. We all contribute to improving to the lives of others. For that, I want to say thank you and welcome to our Board of Health annual meeting.
Staff always love when I go off script a little bit, so I'm going off script a little bit at the moment. We have a guest with us who also has been very committed to the Lincoln-Lancaster County Health Department. Actually, he was employed at the Health Department for 35 years. He retired in November of 2007, and at this point I'd like to ask Gary Walsh if he would come up on stage for just a moment. Gary didn't know this was happening, so I'm sure he's thinking, now what? We have a practice in the city of Lincoln that our employees are awarded with service pins. And Gary served 35 years with the city of Lincoln and with the Lincoln-Lancaster County Health Department. And for some unknown reason, Gary's 35-year pin in 2007 was not awarded to Gary. And so I want to take this opportunity to thank Gary again for his service, and better late than never. But today I wanted to award him with his 35-year service pin. So if you would join me in thanking Gary for his service. There you go, Gary. Congratulations. Now it's my pleasure to review some of the department's highlights from the past year, to talk a little bit about what your Lincoln-Lancaster County Health Department is doing to protect and promote the health of our community and all of your health as well. I want to highlight just a few things from each of our divisions. And as I mentioned the division, if you're part of that division and you're part of our staff today, I would appreciate it if you would please stand. In our animal control division, and we do have some animal control folks here. I know Steve's here. Is he hiding out? There's Steve. Thank you. We're currently licensing over 62,000 pets in Lincoln. And during the past year, we've increased our focus on increasing pet licensing because as the city of Lincoln grows, so does our pet population. We continue to promote the effort to spay and neuter pets, not just because of the pet overpopulation, but because we know that animals that are not spayed or neutered tend to be more aggressive and result in more bites. And in addition, we know when they're licensed, they've also received their rabies vaccination, and that's our connection to making sure that both our pets and the humans in our community are safe from rabies. We've also worked this last year to increase our grant program, and we do still have funds available. So for low-income families in Lincoln who want to have their pets spayed or neutered, we have a grant program through Animal Control, and we've actually raised the amount that we will pay towards a spay or neuter. So for those of you who work with or who know families who are low income and need to do that, please refer them on to Animal Control. But just to know what they did this last year, during the past year, over 44,000 calls for information and service requests came into Animal Control, and over 23,000 calls were dispatched. 2,000 alone, now you think they have a fun job, 2,000 alone were for dead animal pickup, and almost 1,000 were to remove bats. So thank you very much to Animal Control. Our Information and Fiscal Management Division, I know we have a few staff in that division that are here as well. They are our money and our computers, and we can't operate without them. The fiscal section continues to help administer close to $20 million in revenue and manages approximately 50 grants in addition to our tax funds, our occupation tax, and our user fees. Our computer resources section has worked to update and upgrade our computer resources to assure that we are making the changes we need to do in technology. All of our medical records, our dental records, our WIC service records are all electronic. Virtually all of our environmental health department is doing their investigations, their case reviews, and their permitting electronically. And Animal Control this year is making the transition to do that as well. All of these systems would not be possible if we didn't have the support of our information section, and so we appreciate all that they do for us. Now, I know we have a lot in this next division, health data and evaluation. I'm looking at one table because their leader is being recognized today. So if I can have the health data and evaluation division staff, please stand. They've completed some major initiatives. Many of you have been part of those in our community this year. The community health assessment and completing the health profile were accomplished in this past year, and many of our partners helped with this process to update our community health improvement plan, which also was completed in 2015. Go ahead, you guys. A number of health data staff work closely with the Community Health Endowment of Lincoln, Urban Development, NeighborWorks, and others to assist in creating the Place Matters mapping project. This work would not have been accomplished without the work of this division. The health data staff has also partnered with the Partnership for Healthy Lincoln as part of the community's federal pitch grant to assist with program evaluation. The Health Data and Evaluation Communicable Disease section continues to monitor the health of the community, including recognizing and responding to outbreaks of more traditional diseases like pertussis, but also monitoring for emerging health issues that are new for the United States, including monitoring for Ebola, Zika virus, and other viruses previously unseen in the United States. This team quietly handles their work to make sure that the entire community is kept healthy and safe. Last summer, our Health Promotion and Outreach Division, and I know we've got a number of them scattered throughout the room. Health Promotion and Outreach staff, could you please stand? During the last summer, our Health Promotion and Outreach Division provided approximately 90,000 meals at 42 sites to children through the 52 days of the summer food program. That's over 1,700 breakfasts and lunches a day during the summer, when those meals might be the only ones that children eat. Thanks to our tobacco program, over 3,000 rental units in Lincoln have been designated as smoke-free units, with the number growing every day. Our staff provides education to landlords about smoke-free units, reminding them that over 80% of our adults in our community do not smoke. And while many landlords knew that they could prohibit pets, they didn't realize they could also prohibit smoking. Our chronic disease efforts include promoting physical activity through partnerships with planning, public works, urban development, for such things as the N Street cycle track or promoting the upcoming bike share program. They work on employee wellness with city and county government and provide health education outreach to at-risk populations. Over 11,000 patients were served through the health department's dental clinic and the Dental Health and Nutrition Services Division. Could that staff please stand? All of our patients are uninsured or have Medicaid. Over 70% of the dental patients seen in our dental clinic identified themselves as non-English speaking or racial or ethnic minority. Recently, the dental clinic was awarded a grant to assist with partial cost of adding an additional dental operatory so more low-income patients can be served. Our Women, Infant, Children program, WIC, expanded at our North office at 27th and Cornhusker, and they continue to increase the number of families served at that location. Working parents in particular enjoy that location in part because of the close location to Super Saver right next door, and they essentially have a one-stop shop to get their nutrition education, pick up their WIC checks, and be able to use them all on the same visit. Reducing our chlamydia reinfection rates has been a great success for the Community Health Services Division. Could that staff please stand? There they are. In our public health clinic in 2015, the health department's reinfection rate was 2.1% compared to Lancaster County reinfection rate of 8.2%. The Healthy Families America program in this division adopts a national measure of performance in serving high-risk moms and their children. For our health department program, 1.5% of the children in the program were children with substantiated reports of child maltreatment, compared to the statewide percentage of 4.1% of the children served statewide. And I want to stop and just make a mention to this, only because these are moms who are at very high risk. Many of the moms in this program were in the child welfare system themselves. Many of them also grew up as part of Child Protective Service. And so when we look at the impact that the staff is doing with their home visits to very high-risk moms on their generally their first parenting experience, to be able to say that 1.5% have had substantiated maltreatment is substantial. And it makes a difference in the safety of these children's lives and also in their future outcomes and how well they can do in the community. And so we're really very proud of the staff and the work they've done. In addition, the Community Health Services staff has worked with the community to connect individuals to medical homes and to a source of health care payment if they don't have it. Staff have connected nearly 2,000 people to care in the past year. That's an average of nearly 1 an hour. A highlight for the Environmental Public Health Division in 2015 was being selected for the Samuel J. Crumbine Award for Excellence in Food Protection. Could the EPH staff please stand? We got them all out. Thank you. Thank you very much. This award is given to only one agency in the United States each year, and the Health Department was honored to be recognized for the hard work of this staff. To further the food team's efforts to protect the public's health, the City Council recently passed a city ordinance to assure the prevention of contamination of food by hands. This ordinance has a wide impact on the public, and I would say it's as wide as the public health ban on smoking that was passed by the City Council in 2004. The impact will touch everyone who eats food prepared in food establishments in Lincoln. The air quality team implemented unannounced visits this year as part of their compliance to assure compliance with the federal EPA regulations, and also contemplated ways to hold back water from Kansas until they stopped burning Flint Hills. In 2015, the nuisance team investigated 383 garbage complaints, which is down by 34% since June of 2012, when the City Council made changes to the city code requiring garbage service in Lincoln. Doesn't mean necessarily just that those nuisance complaints have reduced. They are also very complex cases. And this team, while the number of cases may have reduced, the complexity has increased. A recent example was a resident in Lincoln who actually moved in from the county. And unfortunately, this elderly person has had a number of issues with hoarding and essentially abandoned the house they had in the county and moved into the city. And again, unfortunately, we have the same issue. And resources for elderly on mental health issues are not only very difficult to find, but also very difficult to achieve. And so our staff is credited for continuing this work and continuing to work with this family to try and resolve the issue. As an entire department, however, all of these divisions and all of the staff that are here today and those that are back at the department who are keeping our services going while all of us are here enjoying lunch, we've developed a department-wide quality improvement plan. We've developed and implemented a department-wide workforce development plan. We've created a performance management system. We've enhanced our customer service and our preparedness efforts. And thanks to the help particularly of Pat Lopez, who's been our consultant, and Charlotte Burke, who has been what we consider our accreditation coordinator and our champion, we recently submitted our preliminary application for national accreditation and hope to be accredited by the end of 2016. Our health department staff have worked on your behalf and continue to work to promote and protect your health and the health of our entire community. Please join me in thanking all of them for the work for this past year. At this time, I'd like to ask 3 of our Board of Health members if they would please join me to present our Public Health Awards. Told you this would actually go a little bit faster today, unfortunately, since Dr. Khan couldn't be here. I promised staff I would not fill his whole keynote time. So, and I'm sure you're grateful as well. So at this point, we're going to move ahead with our awards. Heidi Stark, Board of Health President, Jane Raybold, representing the Lincoln City Council, and Bill Avery, representing the Lancaster County Board of Commissioners. Please join me on stage. Dr. Stark will introduce our Community Award recipients and our John J. Hannigan Award.
The Community Health Service Awards are given to an individual or an organization that has demonstrated exemplary community service and/or volunteerism on one or more health-related projects. Please wait to come up until you are called so that we can see your photos, and please come up to my left or your right. It is my pleasure to recognize our first Community Health Service Award recipient as AAA and Cornhusker Motor Club Foundation. AAA and Cornhusker Motor Club Foundation exemplify the spirit of corporate public service. They understand that they play a vital role in changing community health and safety outcomes through their work to reduce the number of children injured and killed in motor vehicle crashes. And they are dedicated to the work of directly educating our citizens about vehicle-related safety. As an active member of the Safe Kids Lincoln-Lancaster County and the Child Passenger Safety Task Force for the past 15 years, AAA and the Cornhusker Motor Club Foundation provide a great service to our community. Following are a few examples of their community involvement. They host car seat education and inspection events for at-risk families. They hold safety fairs where several hundreds of bike helmets have been provided to low-income children. They provide interactive seatbelt demonstrations to thousands of families at the annual Safe Kids Blast. They conduct a community donation match program each year for all Nebraska Safe Kids coalitions. Safe Kids Lincoln-Lancaster County has received over $20,000 from this program, which allows us to continue providing car seats and child passenger safety educational services to low-income families in our community. They also host National Child Passenger Safety Technician Certification trainings and financially sponsor local Child Passenger Safety Technician in-service trainings. They lead efforts to support public health traffic safety legislation. Because of this demonstrated strong commitment to enhance the safety of families in Lincoln and Lancaster County, the Safe Kids Child Passenger Safety Task Force is pleased to nominate AAA and Cornhusker Motor Club Foundation for a Board of Health Community Health Service Award. Accepting this award are Rose White, Executive Director of the Cornhusker Motor Club Foundation, and Marilyn Muir, Manager of AAA Nebraska, the Lincoln Branch. Thank you, ladies.
There she is. We couldn't find her.
On behalf of AAA and the Cornhusker Motor Club Foundation, I just want to thank you for this tremendous honor. It's always been a privilege and pleasure supporting the Lincoln-Lancaster County Health Department. I want to give a big kudo to Bryan Baker, who's been our main contact over the years. We've worked with him now for well over 15 years, and it's always been a pleasure working with your agency. So thank you for allowing us this privilege.
Thank you, Marilyn.
Thank you to AAA and Cornhusker Motor Club Foundation for what you do for youth and families in our community. Our next Community Health Service Award goes to the Nebraska Pharmacists Association. Unused medications kept in medicine cabinets, flushed down toilets, or tossed in the garbage can seriously impact human health and environment. The Nebraska Pharmacists Association, NPA, has been leading the expansion of a statewide prescription drug disposal system called Nebraska Meds Disposal Project. This project engages Nebraska pharmacies to serve as the safe and legal waste medication collection system for leftover consumer medications. The NPA is dedicated to protecting public health and the environment by reducing the risks of leftover medications that include illegal prescription drug diversion, unintentional poisoning, and damage to Nebraska's ground and surface water resources. Unintentional poisoning is a significant problem in Nebraska. In 2014, almost 13,000 Nebraska residents called the Poison Control Center for help, and 55% of human poisoning exposure reports were from medications. In partnership with the Nebraska Meds Coalition, the NPA and Lincoln-Lancaster County Health Department have been piloting the collection of leftover medication at Lincoln and Lancaster County pharmacies since 2012. 46 local pharmacies have collected over 11,000 pounds of leftover, unwanted medication. This pilot proved that if people are given a simple option to take back and safely dispose unwanted medications at their local pharmacy, they will do so. The NBA stepped up to take the Nebraska Meds Disposal pilot statewide. They received grant funding from the Nebraska Department of Environmental Quality and the Nebraska Environmental Trust to allow medication disposal to be offered statewide, providing a safe and legal option for getting rid of unwanted, leftover medications to all Nebraskans via their local pharmacy. Since the launch of the statewide Meds Disposal Project in January of 2015, the NBA, in collaboration with nearly 300 pharmacies, has collected almost 17,000 pounds of unwanted medications for incineration. The success of this program led the Nebraska legislature to pass legislation to appropriate funds that would ensure continuation of the project. Because of their leadership in developing this winning combination of protecting people's health, reducing the risk of drug abuse, and protecting our environment, the Lincoln-Lancaster County Board of Health is pleased to honor the Nebraska Pharmacists Association with the Community Public Health Award. Joni Cover, CEO of the Nebraska Pharmacists Association, is accepting the award, and other representatives of NPA are here with us today: Marcia Muting, Kristen Anderson, and Diane Webb. Would you please come forward? Right in front. Thank you. Thank you.
I told Judy I had a 30-minute speech.
Go ahead.
I told Judy that I had a 30-minute speech since Dr. Khan wasn't here. I was kidding, of course. I do want to say thank you to the Lincoln-Lancaster County Board of Health for giving us this award. We've had such outstanding partners, including Lincoln-Lancaster County in this project, so we certainly didn't do it alone. We have lots of valuable partners. We're excited about this project. And just remember that every day is Take Back Day in Nebraska. So thank you very much.
Thank you, Joni. Our next Community Health Award goes to the University Health Center and 2 educators of the Health Center, Liam Hirton Rodriguez and Nicole Greenwalt, for their outstanding service to the university students in the field of sexual health. Sexual health requires a positive and respectful approach to sexuality and sexual relationships that are free of coercion, discrimination, and violence. Our nominees certainly take this approach with the thousands of students that they serve. While it's easy to blame the myth that all college students live a hard partying lifestyle, most young people are responsible with their alcohol use and sexual health. However, many college students lack basic information about sexual health. Without the facts, students can struggle to make healthy decisions, especially if they feel awkward, ashamed, or too embarrassed. The University Health Center, through its exceptional clinical services and on-site pharmacy and the use of trained and caring student peers, provides the resources young people need to prevent sexually transmitted infections. As the educational coordinator for sexual health, Liam Hirton Rodriguez was instrumental in implementing the student peer model of accurate, accessible information and support for students. Under the leadership of Liam and Nicole Greenwalt, peers have open conversations empowering students to make healthy, safe, and responsible decisions. Nicole developed the Protection Connection program so that students could discreetly receive safer supplies and accurate information about their use. Our nominees have partnered with the health department for many years on projects to get prevention, testing, and treatment information out to young people. Liam organized a panel for a local healthcare provider conference so that clinicians could hear directly from youth about the barriers they encounter and how they would like to receive services and education. Liam and Nicole also partnered with the Lincoln-Lancaster County Health Department in interviews with Channel 10 Health and 1011 News to dispel common myths about sexual health and the college student. The University Health Center, Liam, and Nicole have been strong advocates for students by listening to what young people need. Their partnership, persistence, creativity, and caring have reduced the real barriers to good health that young people encounter. Thank you and congratulations. Please come forward. Accepting the awards are Nancy Orsborn, Clinical Manager for the University Health Center, Nicole Greenwalt, Health Promotion Analyst with the Health Center, and Liam Hirton Rodriguez, who is no longer at the Health Center, but was able to join us to accept this special award.
On behalf of the University Health Center, I want to thank you for this award. To be able to be awarded for something that we enjoy doing and are so passionate about sharing with the community and the university health students is such a great honor and such a thrill. So thank you all.
Our next award is the John J. Hannigan Memorial Award. This award is presented to a local physician who has exhibited leadership in the medical field and an ongoing respect for public health service. The Lancaster County Medical Society submits nominations to the Health Department for this award. The 2006 Hannigan Memorial Award recipient is Dr. Jason Kruger. Dr. Jason Kruger graduated from the University of Iowa in 2003 and immediately entered his emergency department residency training in South Carolina at Palmetto Health, Richland. In 2007, upon completing his residency, he and his wife Katie moved to Lincoln, and he became an emergency department physician at St. Elizabeth Hospital. During his 8 years in Lincoln, he has held several leadership roles, including president of the Lancaster County Medical Society, president of the Nebraska Emergency Physicians, and treasurer for the Nebraska Medical Association. In 2016, he became the chief of staff at CHI Health St. Elizabeth. In addition to his leadership roles, he has served on numerous local and state board of directors, committees, and task forces. Most recently, he was one of the physician leaders in advocating for a statewide prescription drug monitoring program, which has successfully passed by the Nebraska legislature in 2016. Joan Anderson, executive director for the Lancaster County Medical Society, told us, "Dr. Kruger is one of the first physicians we think of when we are looking for members to serve on a community health committee. He is always willing to serve and advocate for good public health policy." Dr. Kruger also serves as the medical director for Lincoln Fire and Rescue, in addition to other fire districts. In this capacity, he has been invaluable to our community in helping with a variety of issues, including our response to sudden cardiac arrest and assisting with our disaster preparedness. In 2013, he was recognized by his peers at the annual Nebraska Medical Association meeting as the state's Young Physician of the Year, a very prestigious honor. According to Dr. Les Spry, Jason was unanimously nominated by the Lancaster County Medical Society Board for the state's Young Physician honor. He is a strong participant in our community and a natural leader. In 8 short years, he has been extremely effective in numerous leadership roles, as well as being a very talented and well-respected emergency department physician. Lancaster County Medical Society and the Nebraska Medical Association representatives, Joan Anderson, are here to represent Dr. Kruger. Dr. Kruger, believe it or not, and his wife have 4 children. Unfortunately, today they are unable to attend because they are checked into the hospital, potentially welcoming triplets. So, accepting the award on behalf of Dr. Kruger is Joan Anderson. Joan, can you please come up to accept this award?
Well, I just have to say we had to shorten the bio because he has done so much more. But if anyone can handle 7 children, it will be Dr. Kruger, believe me. And I'll be glad to present this to him as soon as those babies are old enough for me to go visit. He doesn't get it before then. But thank you very much.
Thank you.
Our next 2 awards are our Food Sanitation Excellence Award. Food safety is important to all of us, and we expect that our food is safe to eat. We expect that proper procedures have been used from production through distribution. We expect that food has been prepared under sanitary conditions by people who practice great hygiene and safe food handling. Despite these expectations, 1 in 6 of us become ill from food-related illness each year. Our food safety program's goal is to prevent foodborne illness by assuring the food you eat is safe. In addition to training food managers and food handlers, our food team enforces the food code through education and conducting regular inspections of the facilities. Because of that, we ask our food inspectors to nominate each year 2 food establishments that will receive our Food Sanitation Award. And today the board is recognizing 2 of those. Our first is Crackle Barrel Country Store. R.J. Bidler and Therese Bauer, please join me on stage. Situated just off of Interstate 80 and North 27th Street, the Crackle Barrel Country Store welcomes visitors to Lincoln and local residents alike with a warm fire, excellent customer service, and a home-cooked meal. One of 600 stores originating out of Lebanon, Tennessee, Lincoln's Crackle Barrel provides itself with serving a hearty breakfast and home-style meals. General Manager Paul Schmidt and his associates keep the store operating smoothly and are all in when it comes to food safety. Crackle Barrel's commitment to food safety is clearly evident based on their excellent sanitation ratings from inspections conducted by the Lincoln-Lancaster County Health Department. Employees are given an extensive orientation at hire, which includes food safety, OSHA standards, and employee health training. This program is referred to as Crackle Barrel U. In order to keep up with local food handler permit requirements, Crackle Barrel employees are informed by their employer 1 month prior to their expiration date. This is done for staff of over 100 employees by tracking permit expiration dates on Excel spreadsheets and making sure that those employees have their current food handler permits. Corporate temperature logs are used by management, ensuring food is kept at safe temperatures, and specific food safety training programs are available for each position, such as wait staff and line cooks. Crackle Barrel's training reveals itself during inspections, as health department staff have observed rapid cooling techniques, such as pre-cooling meat in ice baths before refrigeration, and use of shallow pans to quickly cool larger portions of food. These practices are known as active managerial controls in the food industry. Crackle Barrel's general store provides retail shopping opportunities and the iconic rocking chairs on the front porch to offer rest and relaxation for weary travelers. Congratulations to Crackle Barrel Country Store for receiving this year's Excellence in Food Sanitation Award. Sure. We'll do a picture? Okay, so we're going to slide down this so they get in front of the blue screen. That's good. Thanks, Jeanette. Go ahead.
I'd just like to thank the health department. I've had the opportunity to work in different cities and counties and deal with 2 other health departments, and I feel like the relationship that we have with the Lancaster County Health Department is very productive. So when they're there, it is an informative process. If there's something that they see that we need to correct, they definitely help coach us and tell us what they think we should do to correct the process. So I think that's very helpful. Also, we do serve a lot of elderly and young children, so it's important that our staff protects their health, and it helps make that easier because every employee gets the health permit through the health department, so that definitely helps with that. I also want to thank all of our employees that we couldn't have done this without them, so thank you.
Our second recipient of the Food Sanitation and Excellence Award is Lincoln-Kawasaki Motors Manufacturing Plant. Dana Visker, Food Service Management, please join me on stage. And we got a whole bunch of the Kawasaki folks, so come on up. Passenger rail cars and all-terrain vehicles are not the only quality products assembled at the Lincoln-Kawasaki Motors Manufacturing Plant. Dana and his 13 employees work with assembly line precision to provide safe, quality meals for over 1,800 plant employees. Due to the huge warehouse of nearly 2 million square feet, Kawasaki operates 3 separate kitchens inside the plant. During inspections, Mr. Visker will take time out of his busy schedule to accompany health department staff and show a walk between kitchens often results in a brief tour of the plant. The sounds of mass production fill the air as ATV frames, personal watercraft, and passenger rail cars make their way down the Kawasaki assembly line. After working up an appetite, Kawasaki employees are served a delicious hot meal and can relax and watch TV in one of the spacious cafeterias. Dana and his staff stay vigilant about food safety. This is evident as no food handler permit violations have been cited in the last 3 years of inspections. Temperature logs are kept for all cold holding of foods, and cooling is aided by incorporating ice baths and ice wands. Comments on inspection reports have noted active managerial control practices of using these ice baths, temperature control logs, and implementing no bare hand contact with food. Congratulations to Dana Visker and the employees of Kawasaki Motors Manufacturing, Kawasaki Motors Manufacturing Food Service team for receiving this year's Excellent in Food Sanitation Award. We're also changing things up a little this year. We have never given our award for our public health leadership to one of our employees. But we decided after 37 years of service in public health 12 to us and 25 to the state of Nebraska, we needed to break a little bit of a tradition. So this year, we are honoring our own Steve Frederick. And Steve, you too get to come up and hear all the good things firsthand. So please join us on stage. For 37 years, Steve has been a fixture in the public health world. The past 12 years at the Lincoln-Lancaster County Health Department and 25 years with the Nebraska Department of Health and Human Services. I think during that 25, it's been Department of Health, Department of Social Services, Department of Health and Human Services, all of the above. Steve brings so much to the workplace beyond his extensive knowledge of data and how to use it. He has a passion for public health and has worked to improve health outcomes and the quality of life of our citizens throughout his career. And Steve just is simply a kind and compassionate guy. He cares about his coworkers at the health department and those with whom he has worked in the past. There are few people in public health across the state that don't know and respect Steve Frederick. In preparing for this presentation, we called upon his longtime friend, Dave Palm, to give us some historical insight and gave us a little bit of sharing on his first 25 years. And Dave, fortunately, had a lot to share. Steve was a trusted leader and a respected policy analyst. People knew his analysis and recommendations would be based on objective and analytical methods. He was sensitive to those Nebraskans with little or no health insurance coverage. In the late 1990s, Steve and others helped convince the governor's office that the new state children's health insurance program should be part of our Medicaid program. This decision allowed Nebraska to enroll more children per capita than any other state except one in the early years of our program. Steve was well known for his work in long-term care. The accurate population projections and formula that he developed for projecting the need for long-term care beds showed policymakers that there was less need at that time than they thought. As a result, Nebraska has met its long-term care bed needs while at the same time saving millions of dollars. Steve also demonstrated his leadership when he supervised the state EMS program. During his tenure, the statewide trauma program, the Emergency Medical Services for Children program, and the EMS trauma pre-hospital and trauma data collection system were established. The data system was one of the first in the nation and is still considered a model for other states. In 2004, Steve brought his experience and knowledge to the Lincoln-Lancaster County Health Department. We knew then, and we especially know now, how important Steve's move to local public health has been to our department and to our community. Steve is a master of data and data analysis, and most importantly, he can interpret it in such a way that everyone understands and can use it. He has moved the department to implement data-informed decision-making processes that have become essential to monitoring health outcomes. Steve has skillfully led the department and the community through extensive assessments of the health of our community that have resulted in our Community Health Improvement Plan, which has involved dozens of individuals and agencies. Many of them are here today. Through all of Steve's work with the emergency management systems, disease outbreak monitoring and prevention, health surveys and analysis, he is the city's go-to guy on data and so much more. He has always had the best interest of the public in mind. He is recognized as a man of integrity and is respected and appreciated by his coworkers and friends. Steve is a joy to work with. He's compassionate and caring for anyone who crosses his path. And I'm sad to say that Steve is retiring from our department in June and will be missed by all. Here to celebrate with Steve are his wife, Pat, and his sister, Debbie Brester. Please join me in congratulating and thanking Steve.
Well, as most of you know, I don't like to do speeches, so, but this is a great honor, so I'll try to luck out and make it through. Really, over the years, I've worked with many very good leaders. I've had good staff. Some are here today. And actually, in my career has been basically it's a luck of timing because we had some wonderful opportunities in the 90s that weren't here today or aren't here today. As I recall, the Children's Health Insurance Program passed the legislature with 43 votes, 1 nay. That wouldn't happen today, even with the program as it is. So, and then we were so successful in the 80s that with Certificate of Need, and I had to testify so many times on so many issues, we were so successful that we won every case, they repealed the law. So that shows you the timing issues there. And I won't belabor all of the issues, but as I said, it's been a timing issue for me all along. In 2004, I came to the department thanks to some recruiting and thanks to changes at the state that made me think that, you know, local health department would be a good place to be. So I've been there 12 years. I'm very thankful to be working with such wonderful people. Listen to me, I'm breaking up, and it's terrible. But that's me. I've gotten very emotional over time, especially about my staff, and Judy. And with that, I'm going to end it.
Our final award today is the Carroll Douglas Public Health Achievement Award. And this award is given to the health department employee that has greatly exceeded expectations in their job as a public health steward and employee in the past year. Health department staff submit nominations for this award. Gary Bergstrom Jr., please join me on stage. Reliable, highly productive, technically proficient, excellent computer skills, attention to detail, team-oriented are just some of the attributes that describe Gary Bergstrom. When you add to that the pride he takes in providing excellent customer service and his focus on quality improvement, you quickly see why Gary is such a highly valued air quality program team member and a department employee. His interactions with the public and regulated businesses are always respectful, courteous, and helpful. Gary has outstanding writing skills. He is one of the best writers in our department and can take very complex technical information and communicate it in such a way that even those without scientific background can understand the material. It's truly an exceptional talent. Gary has utilized his skills to develop many quality improvements that have led to increased efficiency, productivity, and consistency within the air quality program and the Environmental Public Health Division. In addition to his primary responsibility of writing air quality permits, Gary provides assistance in many other areas, ranging from responding to air quality complaints and to conducting noise testing. Most recently, Gary volunteered to be available after hours and on weekends to respond to late-night noise complaints. So to Jennifer, yes, he really was on call on Valentine's Day. Furthermore, Gary embraces the department's mission of protecting and promoting the public's health and has accepted additional responsibilities that directly benefit the department and the health of our community. He serves as the health department's representative on the Lincoln Metropolitan Planning Organization Committee with the important role of clearly communicating the connection between public health and transportation planning activities. He also serves on the department's quality improvement team, which seeks solutions to various problems or inefficiencies within the department to enable staff to better serve the public. Recently, the Quality Improvement Team was tasked with creating a staff orientation process that will ensure new employees catch the vision and quickly grow in their understanding of the mission of the department. Gary assisted the team in developing the solution to managing the department's myriad of policies and was instrumental in helping to identify the software package that will help the department more efficiently and consistently manage our policies. Finally, to help develop and hone his facilitation skills, Gary volunteered to participate in facilitation training offered at the department. He then put those newly developed skills to work by assisting Community Health Services in a planning process. Gary will be furthering his development this fall as he begins to pursue his master's degree through the University of Nebraska Med Center College of Public Health. As you can see, Gary Bergstrom is an employee deserving of the recognition. Today, I'm honored to give Gary the Carroll Douglas Award for his valued efforts to protect and promote the public health in Lincoln and Lancaster County. And celebrating with Gary today are his wife, Jennifer, and his parents, Kathy and Gary Bergstrom Sr. Thank you. There we go.
Well, I'm going to try to keep this brief. I am very humbled and honored to receive this. It's truly an achievement that I couldn't have reached without the help of my coworkers, the staff that I work with in the air team. They make my job a lot easier through the resources that they lend me. I do want to thank Judy and the Board of Health, and I want to thank a mentor of mine who's here today, and it's the second time he'll be called on, is Gary Walsh. He really did help me develop professionally when I first started, so I do want to thank him. And with that, thank you all.
While we still have many challenges ahead of us, we're grateful for how far we've come in public health. And for your closing public health fact, I know how much you love these. In 1929, the health department's rat inspector wrote, "I've been employed by the city of Lincoln nearly 5 years. The worst place I've seen was the city dump. Their rats caused holes in the pavement. Rats are very destructive. For our LFR friends," he said, "many fires are caused by rats chewing on matches and gnawing on wires." At least that's what they told the fire department. Rats cause many deaths. They are great germ carriers. All people should have rat-proof garbage cans so rats can't scatter or eat garbage, because rats admire open garbage cans. In 1929, the rat inspector must have received the Employee of the Year award because he reports the number of rats killed in that year in Lincoln was 32,965. Keep in mind the population of Lincoln at that time was probably in the neighborhood of about 75,000. So with that, our 2016 awards are complete. Thank you all for attending our meetings today. Thank you all for supporting my staff and the efforts of our department to protect and promote the public's health. And thank you all for partnering with us to achieve greater health in Lincoln and Lancaster County. Thank you for being here today.